The TOPAS system consists of two identical stainless steel insertion needles and a specially designed 45 cm Type 1 knitted polypropylene mesh covered with protective plastic sheaths on each end. The center panel of the mesh is 2 cm wide and 5 cm long in design to rest under the anorectum. The relevant anatomy for the TOPAS procedure includes the puborectalis muscle, the obturator foramen, and the obturator neurovascular bundle. After injecting a local anesthetic solution, two matching 1 cm vertical buttock incisions are made, 2 cm lateral and approximately 3 cm posterior to the anus. With the surgeon's overgloved finger in the anus, dissection is performed with a narrow curved clamp between the buttock incisions. A tunnel is created 2 cm deep to the perineal skin and under the puborectalis muscle. A clamp is used to grab and not crush the pink connector, and the mesh is pulled through the tunnel. With the surgeon's overgloved left hand in the vagina, the insertion needle is placed through the obturator membrane. At this point, the needle handle is elevated to the vertical position as the needle passes through the ischiorectal fossa. The connector is then attached to the needle tip, making sure there are no twists in the tape. The needle is then withdrawn to the thigh, and the sling is grasped with a clamp at the level where the single blue marking is present. The needle passer is then cut from the mesh above the clamp. The Kelly clamp is repositioned so that it only grasps the plastic sheath and not the mesh on the patient's left side. The plastic sheath on the left is advanced approximately 5 cm. This exposes the center panel of the mesh. The procedure is then repeated on the other side. The insertion needle is advanced through the medial portion of the obturator foramen, perforating the obturator membrane. At this point, the needle handle is elevated to the vertical position as the needle passes through the ischiorectal fossa. The connector is attached to the needle tip, and the needle is withdrawn to the thigh incision. A clamp is placed over the mesh arm at the level of the single blue mark, and scissors are used to cut the mesh assembly over the clamp. The plastic sheaths are removed. The mesh is then cut at the level of the skin, and the thigh incisions are closed with absorbable suture. The final position of the TOPAS system closely mirrors the normal position of the puborectalis muscle.